Hey everybody, I am joined here today by Dr. Shel over at Dr. Shel Wellness and Aesthetic Center. You can find them at drshel.com. And so we're here to talk about their treatments specifically for ED, along with some of the main causes and the treatments that they provide there. So doctor, thanks so much for joining us today. Really appreciate it.
Great to be here.
And I wanted to just start off by asking you about your experience working with these patients and what got you interested in being able to help them.
Sure. So, being in medicine for the last 25 years, I think it's something that has been a big interest for me because I practice functional and integrative medicine. And basically, what that means is we try to get to the root cause of what's going on with our patients, whether they be men, women. And it's really important because a lot of times patients will go in to see their primary care docs and either they're just too embarrassed to talk about it or nobody ever asks them. And so it's really becomes somewhat of a tragedy because people suffer in silence because nobody asks. And then there's no actual way to talk about it. And so they're looking online and trying to find out information. So
Mhm.
I've actually always been a big proponent of education. And we like to ask all of our patients when they come in. In fact, we do about a 13-page questionnaire and we ask them about everything from their lifestyle, their stressors, their diet, their exercise, their sexual health, their hormonal health, mental health, everything from, lifestyle to what they're taking, what they're eating, how they're living, and their personal histories. And so I think it's really important to make sure you look at the whole person. And that's where we really find out what's going on. And if they are dealing with, for the purpose of this conversation, if they're dealing with some sexual health dysfunction or erectile dysfunction.
Yeah, absolutely. And I think for a lot of patients too that do go in and see their primary care doctors, a lot of times if they ask to get, testosterone levels checked or anything like that, unless that doctor specifically knows what to look for, they might see that they're within a normal range and just, let them know that their symptoms, there's nothing they can do for it essentially.
Right. And I'm so glad you brought that up, Caleb, because, there is a whole discussion that needs to be had about within normal limits, right? So if you think about it, most laboratory tests that, one does when they go to their PCP, the level of total testosterone, which oftentimes is all that they're getting tested, is a total testosterone. And I'd like to tell you and the listeners, more importantly, because you probably know this, is that it really is important to look at total and free testosterone,
Mhm.
because free is the unbound testosterone that is actually active and can be utilized by the receptors in your body.
Sure.
But when you look at the total testosterone, if you look at the range, it can be anywhere between 250 to 1100.
Mhm.
And depending on the lab you're looking at, you will have this within normal limits. So say you come in with a testosterone of 300 or 350, and where you're really used to living when you were in your 30s, or even, earlier, if you're a young man already in your 30s and your testosterone's getting low, which you and I both know happens quite frequently, unfortunately, it can be very, very suboptimal, giving all the side effects of low testosterone. And there
Mhm.
are so many of those, right? There's all the symptoms of low stamina, low energy, low libido, erectile dysfunction, inability to sleep, inability to function properly, and depression, anxiety. So many things are related to testosterone. So when
Mhm.
you are within normal limits, you're not optimal. And
Right.
optimal to me needs to be at least around the 800 to 1,000 area, right?
Mhm.
That's what we aim for. And when you look at the free testosterone, we're always trying to optimize the free testosterone because even if your total testosterone is decent, maybe in 600s or 700s, if your free testosterone is really low, you can't use it. And
Yeah.
so it really defeats the purpose.
Yeah, absolutely. I think when they give patients that range, they need to have like a little sad face on the lower end and a happy face on the higher end there.
Exactly, exactly. And so it's really interesting because, things are changing, thankfully, and I hope they continue to change more because more and more patients are getting more educated on this and they're getting more informed on this, and they're not looking to be just in the normal limits, they're looking to be optimal. And so
Right.
we can get them there naturally, as you know, and, there are many different ways to get them there.
Yeah, absolutely. And so with ED specifically, what do you find are really some of the main causes and reasons why somebody would be suffering from that?
Sure. Well, the first thing I would say is look at the environment we live in. Look at the food we're eating. Look at the stress we're under, right? So a lot of it is the environmental toxins that we're exposed to, whether it be in our cleaning products or our personal hygiene products, or just being around chemicals that are sprayed everywhere and different paints with lead everywhere. People still have different kinds of mercury fillings. These are all heavy metals and other toxins that we're exposed to. So we're always testing our patients for toxicities to make sure that we eliminate those toxicities, and we counsel our patients to make sure that they are using very natural products without the chemicals, without the parabens, without the things that are going to cause toxicity. So toxicity is one. Number two, it's what you're putting in your body. So what are you eating? Are you eating, organic foods? Are you eating, beef that is grass-fed? Are you eating chicken that doesn't have antibiotics and hormones? Are you eating good, solid foods that actually nourish your body, or do they take away from your body? Because that can affect your hormones tremendously. What's your microbiome doing? So we look at the microbiome, the gut. I see about 80% of the patients that walk into our office, if not more, have gut issues. We have this IBS that everybody has. Basically, what that is you're inflamed. You're inflamed in your body. It might start in the gut, but it goes to your brain, it goes to your sexual organs. So any and all of those things, including stress, when your cortisol is completely imbalanced and you're living in a fight or flight mode, you cannot make the hormones that you need to make. And your receptors can't bind the hormones that it needs to bind. So all of those issues can cause issues with low testosterone, and then, of course, erectile dysfunction.
Yeah, definitely makes sense. And I think for a lot of patients are starting to realize that, having good sexual function is going to be directly related to their overall health as well. And so I think
Yes.
hopefully we're starting to look at that more and more and just realize that, you really can't have one without the other.
Absolutely. I think it's such an important point that you make, because when you don't have the appropriate sexual function that you want to have, whatever relationship you might be in, it really takes a toll on your emotional health. And when you have emotional health that is suffering, then stress is going to go up, and it's just going to become this vicious cycle. Also, there's a lot of self-esteem issues that come up with that in a lot of men and women, right? We treat both. And so it's really important, first of all, for us as clinicians to open up the conversation and make our patients feel comfortable to talk about it. And
Mhm.
secondly, to really educate them as far as what caused it and what can we do to treat.
Yeah, absolutely. And so with the treatments that you focus on there at the practice for ED, can you walk through what those are and really how those help patients?
Absolutely. I always like to start with balancing my patient's body.
Mhm.
So we're going to start with, of course, balancing the hormones, balancing the nutrients. We love to actually test and treat very target. I don't like to just give supplements, but I like to test their nutritional deficiencies in vitamins, minerals, antioxidants, free fatty acids. I like to look at their gut microbiome. I like to look at their hormonal health and their cortisol and their thyroid, because all of those work together. It's almost like a symphony orchestra. You've got to have all the different instruments working together to produce beautiful music. So once we look at that, then we counsel our patients on everything that's sort of non-invasive, non-surgical. Obviously, we know there are medications out there that you can take, and those could be short term. But if you think about what do you want to do that's more long term, um, some of my favorite treatments are, first of all, there's a chair that is called Ancella chair. It is absolutely state of the art. It stands for electromagnetic stimulation of the pelvic floor muscles. And so you're essentially sitting on this chair and stimulating the pelvic floor muscles about 11,000 times. So it's as though you're doing 11,000 Kegel exercises in about 30 minutes. And why that is important for erectile dysfunction is everything is a muscle, right? I mean, we have muscles down in our pelvic floor. So whether our male patients come in with urinary incontinence, whether it's stress incontinence, urge incontinence, mixed incontinence, or having nocturia, which a lot of men suffer with that, And it a lot of times goes hand in hand because they might have some prostate issues. And so Emsella has been FDA approved for incontinence in men, as well as has been shown to really dramatically improve erectile dysfunction issues. So that's one, and it's super easy. You're sitting fully clothed on this chair, which is really essentially state of the art, like I said, and 6 sessions twice a week within 3 weeks, you're really noticing a big difference. And you haven't done any procedures, any surgeries, no needles, no nothing. So that's one. Another one that is one of my other favorites is the P shot. And the P shot is super cool because in erectile dysfunction, as you know, the listeners probably know, it basically is from the inability to keep and maintain an erection during sex. And it causes men to have a decreased amount of blood flowing to their penis, causing it not to stay erect. So that's basically what's causing it. You know, we mentioned several causes, but it also could be caused by medications. And a lot of men nowadays are on medications, including high blood pressure medications, or they might be diabetic, or they might have kidney disease or Peyronie's disease. And so when this is happening, what we want to do is we want to increase the blood flow to the penis so that the men can have better erections. And so that's essentially what the P shot is doing. It is going to utilize your own platelet-rich plasma to be injected into the penis. And of course, it sounds, oh gosh, I would never want to do that. But we're so good at numbing the area and making sure that our patients are comfortable, that they're just like, okay, is that it? Is that it? Is it done? And so this will give firmer and longer lasting erections because it'll increase the blood flow. It'll improve men's sexual health overall because, in fact, that will also help desire, because the desire and the function is very closely connected.
Sure.
Because if you can't have the function, you're going to have some self-esteem stuff and you're going to have some emotional issues with that, and the desire goes down. There are a lot of men that might have some pain, prostatic pain, or even urinary incontinence type of pain, and it provides some pain relief. It improves the sense of well-being because everything is just getting very healthy. It's very minimally invasive. It's safe. It's non-surgical. It's a quick treatment that does not require surgery. And although there are surgical therapies out there, but you know, who wants the downtime? And then it's drug-free, which is important to know because we're using your own platelet-rich plasma. So for those people who don't know what platelet-rich plasma is, we draw your blood, we spin it down in a specific kind of a tube with a specific centrifuge, and then we're able to separate the platelet-rich plasma, which essentially has 10 or more collagen-derived growth factors that stimulate wherever you're going to put the platelet-rich plasma, because we use it in men for the P shot, in women for an O shot, we use it for hair loss, and we use it on the scalp, and we use it for the face for rejuvenation with microneedling. So it's a fantastic treatment that can be really used in many different ways in different areas.
Well, that's really great to hear. And you mentioned too, so I know a lot of patients are trying just medications with like Viagra and Cialis. If they're maybe taking those and let's say they have too many side effects, do you typically find that they're a good candidate for these treatments instead?
Oh, absolutely. So, you know, you nailed it. A lot of people have tried those things and they do have side effects. And so they'll come in and want to do something that is natural, non-invasive, can actually improve the physiological condition that is probably leading to the dysfunction to begin with, right? So I think that's really important to know that there are options and there are solutions available that can be more physiological and get your tissues back to where they were before you started getting erectile dysfunction. And we know this about PRP, right? It is sort of the thing. It's like the fountain of youth almost, to give yourself back that collagen that you've lost in all these different areas of your body. I really love, in my practice, I like to combine different treatment protocols. So I love combining balancing and optimizing your testosterone, right? Optimizing your nutrition, your lifestyle, your stress, along with the Emsella chair, because you really want the pelvic floor muscles to also get strong because the orgasms are better then, right? And using the P shot to get more blood flow to the penis itself. So it's
Okay.
a great combination approach.
Yeah, yeah, no kidding. And how long do you typically find that patients need to be, doing these treatments before they really start seeing some results and success?
Yeah, that's a great question. So our patients are seeing results pretty quickly. Now, it's very different in everybody. So for some people, you can see a result within 24 hours. Others, it might take a few weeks, sometimes even 4 to 8 weeks. So I always tell patients, it's important to know that you're an individual, your body's an individual body, and it also depends on what were your root causes. Are you working on those in conjunction with the P shot? And that's why I kind of come back again to comprehensive approaches to treatment, because it's not a one size fits all. B, it is about why did you get here to begin with, right? Is it because of your testosterone? Is it because of your toxins? Is it because of your stress? Is it because of your, microbiome? What is going on? And that's kind of why I really do encourage my patients to do a comprehensive, more functional medicine type of approach.
Yeah, absolutely. That makes sense. And so once they see some success with those treatments, are they able to continuously do maintenance treatments after that to keep the results going?
Yeah, that's a great question too. So patients also tend to see results improving with time, and the effects can, what we've seen in our practice is the effects can last from a year up to 2 years in some cases. So again, everybody's different. Some of our male patients come in every 6 months. Others are like, I'm still good. But I believe it's because we're doing everything else too, right? So if you're only going to do P shot and nothing else, and you're not really fixing anything else, it's not going to last as long.
Mhm.
That's how I counsel my patients. But if you are going to look at you as a holistic being, then you're going to have better results and more longer lasting
That
results.
makes sense. Yeah. And I
Yeah.
think for a lot of patients too, they're willing to put in that time and the effort into getting the results. But I think for a lot of them, they probably have just kind of thrown their hands up and think that the only options is to take, Viagra and Cialis and
Yes.
basically just completely rely on those.
Exactly, exactly. And I think that's really important to remember. I mean, you make a great point, is it's important to just educate yourself and know what are the options out there and what might be the best option for you. Because again, it's not a one size fits all. Everybody's different and everybody's going to need different things. I would also really, like to point out that, we talk about um, menopause all the time, right? I mean, how many books are there on menopause? How many shows are there on menopause? How much do we talk about it? It's like a household term.
Right.
How many people even know that there's a word called andropause
Mhm.
for men who end up, declining on their testosterone and their hormones?
Yeah.
I would say 50% of the population probably don't know that there is a term for it.
Mhm.
And that just makes you realize that how many of us are actually focusing on men's health from that perspective? And are we doing our part as clinicians and educators? And that's why, Caleb, I'm so happy that you're doing this and trying to create more awareness for men's health, because I think that it's a part of the population that oftentimes we're just not talking about it, because a lot of men, hey, society says be tough, be private, be whatever, and I'm totally not a subscriber to that. I think it's really important to talk about these things. It's really important to realize we're all human beings. We're all going to age.
Mhm.
All of our glands are aging, right? Our gonads are aging, our thyroid is aging, our adrenals are aging, and our cells are aging. So on the mitochondrial level, it doesn't distinguish between a male or a female. And so I would like to just sort of make the point that kudos to you that you're doing this and trying to spread the word. And also to all the men that are listening and the women that might be listening, go get help. If you're suffering in silence, find somebody that is comfortable talking about these things and giving you more options than just a prescription, and are going to talk to you about what got you here to begin with, what caused this to begin with. It's really important to find a clinician that you trust, that becomes your co-pilot, doesn't always just tell you what to do, but talks to you about what will work for you, what really bothers you, how did you get here, and how are we going to get you back to your revitalized, energetic self that you want to be. So I think education is really important, and being your own advocate is really important. And what I'd love to say to the women who are listening is, I'm sure if you have a partner or a father or a brother or a friend that you care about, let them know there are options. They don't have to suffer in silence. And it's not just about erectile dysfunction, right? You could have sexual dysfunction and your erections might be fine. It could be the libido. It could be, immature, premature ejaculation. It could be a lot of different things that need to be discussed, because there's no sense in suffering in silence when you have options.
Absolutely. No, I think that's a fantastic point too. And I think for a lot of men, like you said, we're just told to be, tough and just kind of hide it. So I think when you approach it as, let's figure out how we can optimize our health and really be the best that we can be. It's not so much that you have to come in and admit that you have something that's not working well. We're just looking for ways to improve that.
Exactly. Exactly. And, if there's any clinicians that ever listen, ask the question. It's a big part of our questionnaire. Do you have sexual dysfunction? Do you have erectile dysfunction? If nobody asks you, it's going to be really hard for a patient to bring it up. So,
Yeah,
it's something that we have done for the last couple of decades. We ask the question and open up the discussion. So I think that's really key.
definitely. Yeah. And so, in your opinion, when should somebody really seek professional help and come in? Is there specific signs they can look out for if they're not sure if they need to?
Sure. It just, how do you feel? Are you exhausted all the time? Or are you more tired than you were? Do you have stamina? How are you doing in the gym? Are you seeing results? Are you able to lift as much? Are you able to walk, run, whatever it is that you're trying to do? Do you feel stressed all the time? Are you sleeping well? Do you have erectile dysfunction? Do you feel like your libido has gone down? Have you lost interest in sex? Have you lost interest in life? Have you had difficulty with your relationships? How are you doing at work? How are you balancing your health and well-being? Are you taking time for yourself? And when you look at, am I losing hair? Am I gaining weight? Can I not lose weight? Am I losing muscle? I can't keep muscle on or build muscle. Am I tired? Am I not sleeping or able to sleep? Am I depressed? Am I sad? Am I anxious? These are all symptoms that could be very, very clearly related to hormonal, lifestyle, and nutritional imbalance. And when I say hormonal, I talk about everything from your sex hormones, which is your testosterone, estrogen, progesterone, DHEA, your melatonin. I'm talking about your thyroid. I'm talking about your cortisol, your adrenal hormones, talking about all of them, because like I said, they all have to work together. So any and all of those symptoms are triggers, and they should have you ask the question, what can I do to feel better?
Absolutely. No, I think that's fantastic advice. And I think for a long time, we've just gotten used to, well, if you have this problem, then just go take this supplement or this medication for it. And we've just kind of moved away from really trying to even address that root issue of it.
Absolutely. And I like to call it the Band-Aid approach. Okay, so you have a little thing, a little cut, put a Band-Aid on. Well,
Right.
why did you get a cut? Let's
Mhm.
let's make sure we don't get that cut again, right? So let's find out why these things are happening. Let's not put a Band-Aid on it and just move on, because one day it will catch up with you. It
Mhm.
catches up with all of us.
Yeah, absolutely. And so, what would be the best way for patients to get in contact with you there if they wanted to come in for a consultation?
Yeah, sure. So, couple of things. The best online ways to go to our website. It's drshel.com, drshel.com. I also have a podcast where we do a lot of education, and that is on drshelinstitute.com. And then they can just simply call the office at 281-313-SHEL, SHEL. So
Okay.
any of those places work. But
Okay.
we do complimentary consultations, and we see patients literally all over the country virtually. So don't hesitate. If you're suffering, then we're here to help.
Definitely. Well, that's great to hear. Yeah,
Yeah,
I love the work you guys are doing there. Was there any last advice or anything you wanted to leave them with if they're, thinking about any of the things that we talked about here?
yeah. I mean, what I would say is be your own advocate,
Mhm.
and really just search for answers and find somebody that you can trust, somebody who's going to treat you with compassion and listen to you and really work with you as your co-pilot so that you can live the best life that you deserve to live.
Definitely. I think that's good advice.
Thank
All right,
you.
awesome.
Yeah, great seeing you, Caleb.
Yeah, thank you so much for taking the time to talk with us today. I really appreciate it.
Pleasure. My pleasure.